welcome everybody, and here is my podcast for my cancer journey, the second of our podcasts with Dr. Rosy Daniel. Dr. Rosy is an integrative doctor and believes in all things to do with holistic medicine. And also Dr. Rosy specialises in working with cancer patients and those who care for cancer patients. She is also the founder and the course director of Health Creation. Welcome, Dr. Rosy Daniel.
Hello, Jo, and hello, everybody that's listening.
So lovely to see you again. So today, because we have so much to speak about, we have broken it down, and today we are going to talk about health and nutrition and how this can benefit us in general, but in particular in connection with wellness and with cancer. So here's a topic for us to explore today, Rosy.
Brilliant.
So I am going to ask you, last time I spoke with you, I asked you if you could share 3 things that you do for your own self-care. And this time I'm going to ask you, what 3 things do you take on board for your own nutrition, for your own wellness?
Oh, thank you, Jo. And perhaps before we go there, you very sweetly last time asked me about my why. What's this all about for me? Why have I got so involved? And I'd like to ask you that. Why are you doing this?
Okay, thank you, Rosy. So my reason why is because there is so much wisdom out there for people to glean, to take on board, to find out about, but it is such an overwhelming topic. And so my hope and dream is that by doing these podcasts and sharing my cancer journey, that people can hear it in a way that it gives them then the proper information from the people who are the experts, with no expectation other than it gives them people choices. And I think that to have the strength of the knowledge then gives the power of a choice, which so often we don't feel like we have because we're in that fear or overwhelm. So that's my why.
Well, that's such a lovely, generous thing to do, Jo. And thank you so much for coming out with your story, and using all that you've learned to benefit other people. That's absolutely lovely. So you asked me 3 things that I do for my own nutrition. Yes. So probably one of the slightly quirky ones is that I buy a couple of punnets of blueberries every week. I put them in a pot with just a tablespoon of water and a tiny dash of maple syrup, and I make a compote. I just boil it for about 5 minutes so that all those lovely black juices run out of the berries, and then I have a small bowl of that every single day. So it's like a beautiful black blue tonic. We know that blueberries are superfoods and they're so delicious. And I find when you just make them into a compote like that, they're so much more tasty. So that's number 1. Number 2, I didn't used to believe in this, and we'll come to this, but I try to avoid taking in too much acidic food and drink, because I've now been thoroughly convinced by my Ayurvedic doctor friends that it's acidity in the body which lays it's one of the things that lays the ground for infection, inflammation, and cancer. So that's meant cutting down dramatically on wine and even things like tonic water, which are pH 3, all other fizzy drinks, teas, coffees, sour fruits. So that's a biggie. And the third important thing is just vegetables. So forget 5 a day. I try to go for more like 10 a day. whether that's salads, stir fries, juicing, you name it. But any way that we can get beautiful, fresh, crunchy vegetables inside us is the way forward, and particularly of different colours.
Yeah. And they always say a rainbow, don't they, Rosie? And I think that that's so true. It's just really try and bring in the variety of the rainbow colours, because they all bring their own added value to the table.
Yes, and it is those colourful pigments. They're the plant chemicals, otherwise known as phytochemicals, polyphenols, and for example, the red in tomatoes is lycopene, the yellow in the skin of a lemon is limonene, the catechin in green tea, and so on. You know, tangeratin, and you know they've all got a name, but these have been found to be crucial in protecting the body from cancer, and even into healing the genes way in the nucleus of our cells. So it's not just for curly hair or seeing in the dark. These are the foods which keep us protected, can actually mend the genes, and also keep us young.
Yeah, thank you. Thank you. Okay, so the first question today on our podcast is, why is healthy eating so important? And also, what about the range of nutritional approaches and the potential conflicts that these can create?
Wonderful. Well, I've really touched into this already, that it's our nutrition which is feeding all the metabolic processes in our body, and helping with every single aspect of tissue and organ functioning. But it's also about keeping the body fresh and vital. So you'll hear a lot when you read about this, or listen to podcasts about antioxidants in food. So what does that mean? Well, when things, the easiest example is rusting, is when is a piece of iron oxidizing. So it's breaking down from pure iron to iron oxide. It has been oxidized. And there are lots of processes in the body where, I guess it's the start of things, tissues degenerating. So it's in those kinds of conditions in the body, acidity, when it's anaerobic, i.e. without oxygen, and also when there's lots of glucose around and sugar, that those breakdown processes occur. So, and it's very strange with glucose, because that is the fuel on which our cells run. But if we have too much of it, it becomes toxic to the body. So the real biggies when we're trying to eat to prevent cancer or turn it around is, as I've said, vegetables, vegetables, vegetables in any form or shape, whether it's smoothies, juices, stir fries, salads, roast veg, steamed veg is really great, low sugar, and also keeping away from mammalian dairy foods. So foods made from milk, and that's any creature, whether it's goat, sheep, cow, because milk is a growth food, and it has some 37 different growth factors in it. So you think of a tiny baby lamb coming along, born this big, and then 3 months later it's that big, and all it's had is milk. And that's what milk is for. And it's been linked, there have been a number of studies linked to the fact that in countries like China and Japan, where they have very low intake of dairy food, the cancer rates are much, much lower. So this is something I'm advising that people move away from the milk, the mammalian milk-based foods, to vegetable foods. And then we get on to the more controversial point about meat and fish and so forth. Now, when I talk about the range of dietary approaches, you can find things which are dedicated to helping people with cancer with diametrically opposite views. You can have people saying you have to go completely vegan, and at the extreme of that, and the Gerson approach, where people are going entirely plant-based, having 12 juices a day. doing coffee enemas, to the other extreme where people are going ketogenic, leaving out all the carbohydrates, but eating extra protein, which is driving people towards more meat. So that's an extreme version of this. What they all agree on is eat vegetables. And what they all agree on is keeping the sugar intake low, so that we're not driving the pancreas so hard and making ourselves open to things like diabetes and obesity, but also so that we're not, insulin itself is a growth factor. I mean, it's logical. You eat more, your body, what does your body do with it? Grow. So, so not eating more than we need, you know, we live in a society where we are by and large overfed and undernourished. So we're moving towards really high nutritional quality foods like nuts, seeds, beans and pulses and all the vegetables. And I personally feel that having a nice base of grains like grained brown rice and maybe buckwheat or millet, jumbo oats. So I'm not a particular fan of ketogenic diet, where the idea is to have people really more living on fat and protein as their fuel foods. I think that gets us eating further up the food chain, which is another controversial thing to be doing, but there are more toxins in animal foods than there are in plant foods. So for me, the key is still being largely plant-based. If we're going to eat fish and meat, it's all about the provenance, going for wild if possible, and organic, and having it, you know, as a treat as opposed to every day.
Thank you so much for explaining that, Rosie. That's really helpful. So can we talk about supplements?
Yeah, there's people say, well, if you're eating such a fantastic diet, why on earth do you need supplements? Well, there's a few things here. A lot of us who are living sedentary lifestyles don't really need an awful lot of food. And I'm a big fan of the company Cytoplan, who they make vitamins and supplements that are both whole food and food state. So they are naturally sourced and given to the body in the closest way to the way we would receive them through food. And they've worked out for somebody sitting at a desk all day, the calorie requirement might only be 1,500 calories, but unless every mouthful is organic and really well, you know, really beautifully grown in rich organic soils, would we get the nutrients that we need? So it's really about trying to uplift the quality of the nutrition that we're having and put back what might be years of lack. You know, we might have been eating insufficient nutrients, especially if we've been into eating fast foods or the rather rudely called junk foods, but, you know, things, ultra processed foods where there just ain't a lot of nutritional quality. But the big thing is to get the antioxidants in, which are the vitamins C. Well, all of them actually. We want A, we want B complex, vitamin C, D is essential, and it's now known, lack of D is now known to be a cancer risk. So we've got an issue there with people have been told put on lots of sun cream and block the sun, but we need some sun to make our vitamin D. And we need, if we have cancer, to be supplementing that. E is important. The other thing that I think is vital is some immune boosting. So the one I favour is called beta-glucan, which is the active ingredient in many mushrooms. And so I recommend, it's called Max Immune from Cytoplan, which is a beta-glucan supplement. But you'll hear about many others, turkey tail mushrooms, shiitake, mitake, different mushrooms, cordyceps, that have got all these brilliant, not only the beta-glucan, but other fantastic cofactors, which literally lift up our white blood cell count and its fighting force, the number of natural killer cells within it. So that's very important. Some people also go for MGM3, which is another mushroom extract, or inositol phosphate. So these are different ways to go. But the biggie when we're raising our immunity is how we feel emotionally. So we're going to, I know, talk a lot about that in episode 3.
Yeah, definitely. Thank you for that, Rosie. So can supplements be taken alongside traditional medicines?
Okay, so you can take the immune boosters all the way through chemo and radio. You can take ordinary vitamins during radiotherapy, but what we do during chemo is we stop the day before, the day of, and the day after IV chemo to give it a chance to work unopposed. Most chemo doesn't last in your system many days, so it's already fading by the second day after your chemo. It's really fading away, and it's good then to start off again.
So I think that that's something that a lot of people are unsure about. So hopefully that information will help them.
And I know a lot of oncologists now are saying don't take anything at all, but that's coming from a place of them not having trained in these things, as opposed to any factual evidence saying that there's a problem. They've made a blanket sort of, we don't know, so let's advise against. But one chap, Professor Kedar Prasad in the States, had a full-time job actually studying the interactions between chemo, radio, and vitamins. And he said, if anything, these things chemosensitize the cells and radiosensitize. So he actually has a protocol which suggests taking more.
Wow.
There's another protocol, Victor Logo, who's talking about actually eating less going up to chemo so that the cells are more vulnerable, because cancer cells are growing fast, so they need a lot of food and energy. So that's another theory that's around.
Thank you. So biggie question, treatment for cancer and supplements. Does it have to be an either or?
Absolutely not. That's the name of my game, as it were. I'm an integrative health doctor. So it means weaving the best of both worlds together. You've just heard that it's good to back off with the vitamins for those couple of days around chemo. But actually, in all the studies that have been done about people taking vitamins alongside chemo, the outcomes are better, the side effects are less. So it's important to weave these things together. And that's why having an integrative health doctor is really helpful, because our orthodox medical friends, this doesn't come into the syllabus. When I was studying medicine, I think we had one lecture on nutrition in 7 years, which was actually about people who had specific dietetic needs, like if they had kidney failure or diabetes. It wasn't this side of things at all. So we tend to have very much more specific training. So whether you're being helped by a nutritionist, a functional medicine practitioner, or an integrative medicine doctor, we have a lot to offer.
Yeah. Yes, and you most certainly do. I can vouch for that myself. So herbs, let's talk about herbs and the power of herbs.
Yeah, well, there's a gold mine out there in the world of herbal medicine. There are many, many traditional remedies. One of the first things that popped up was the use of mistletoe, coming through the school of anthroposophy, Rudolf Steiner, Dr. Ita Wegman, who looked very much at the signature of plants, and they recognized the way that mistletoe grows. It looks like a tumor, the way it's growing on a tree. And they started distilling this into a medicine. giving it to people with cancer, and found that it actually helps raise the immunity. So it's giving a foreign substance, a bit like in a vaccination, which is causing the immune system to wake back up again. Because a big part of the problem in cancer is that the immune system is somehow cloaked. It's not seeing the cancer that's developing. So anything that can fire up, spark up the immune system again is going to cause this immune reaction. Another next big one was ESSIAC, the nurse Renee Cass, who brought that in from Native American Indian culture. She was working as a nurse out there, noticing that her Native American Indian clients were doing much better than her white Canadian people. And she tracked this back to this medicine with 5 different herbs in it. A lot of lights went on for me when I went out to India and met an Ayurvedic doctor called Dr Nandlal Tiwari, who told me about a traditional medicine that's been used in the Assam region for generations, which is called Carctol, Carctol. Now that's got 8 herbs in it, but when I went, he introduced me to a big room full of people who were living 5, 10, 15 years past their prognosis. I got very excited. He was the one who said to me, you have to take acidity seriously. So I started getting my clients to measure salivary pH first thing in the morning, before water, coffee, tea, breakfast, before anything, in a neutral mouth, and found that my people with cancer were way more acidic than their family or me. So the Carctol, interestingly, none of the 8 herbs, if you look them up in the formulary, say that they are cytotoxic. So it doesn't work by killing cancer cells, but it does cleanse the liver, the kidneys, the bowel, the lymph. And I've had some staggering results with that medicine. One lady recovered from stage 4 ovarian cancer without any chemo or surgery at all. It took a long time, but she plodded away, and it took about 3 years for her liver to clear and about 4 years for her wound to clear, pelvis to clear. And that was 23 years ago. So, you know, these are the kind of results that people have that changed me from believing these things work to knowing these things work. And you know, in my role, it's really like being a detective trying to find the key that's going to unlock this whole process for a given individual. And as we'll hear in our next episode, for some people, that can be much more about what's going on in their lives, you know, if they're broken-hearted, broken-spirited, lost, lonely, you know, lacking any love really and nurture for their soul. But going back to herbs, there are other herbs we use for symptoms, like aloe vera, if around the time of chemo, because it can be a bit burny on the gullet. Milk thistle can be useful between chemos to flush the liver. And I could go on. There are many marvelous magical herbs. And I know Walida, that we both adore, has got a whole basket full of treasures in the healthcare section that can be used for all sorts of things.
Yes.
Mm.
And we also, you know, we all have herbs in the garden. And, you know, for anybody who has some herbs in the garden, go and have a look at the properties, the medicinal properties of those herbs in your garden, because they too will have properties that can help you and in different ways. So, you know, don't ignore what we've got by our door, because we often have things that are there to help us as well. So yeah,
Absolutely.
absolutely agree with you,
But
Rosie.
I think care of our digestive system during chemo with aloe vera or slippery elm is a must. That can make all the difference. And as you say, there are beautiful tisanes, you know, mint teas. But another tip for the time of chemo is peeling a banana, popping it in cling film, popping it in the freezer, and then if everything feels a bit hot and burny and sore, just having a banana lolly to suck is a nice thing. And if the mouth gets sore, zinc lozenges, which you can get from online stores like Your Health Basket, or health food shops often have zinc lozenges.
Thank you, Rosie.
Mm.
So alternative treatments for cancer, and what about the trend for repurposed drugs? Can you have
Okay.
a talk about that a little bit?
Yeah. So I think there's a spectrum. So with all of this, there's the integrative approach where we're trying to get the best of all worlds, orthodox, complementary, self-help nutrition, psychological, spiritual, so that we're supported and nurtured and nourished at every single level. There are a lot of complementary therapies which can soothe us, like touch, aromatherapy and reflexology, terribly brilliant for symptoms. So reflexology can help get your bowel moving again after chemo. And then there are the lovely energy therapies like shiatsu and acupuncture. So quite often if people are very out of balance, perhaps emotionally or physically, those two ancient therapies can be brilliant for just bringing people back into balance again. But on the nutritional side, there are, as mentioned, a big range of things. There's a book out called You Can Starve Cancer by a lady called Jane McClelland, who is an absolutely brilliant, mind-blowing biochemist who's looked at all the metabolic pathways and how we can potentially block them and block cancer growth through what goes through our mouth. And this has started a trend for these repurposed drugs being used to try to block cancer growth pathways. Now, I have complete respect for Jane and what she's doing. I have, however, seen some people starving themselves, never mind the cancer, that they have been trying so hard to get their blood glucose level down that they just haven't been eating enough food and have ended up very, very thin and very dismayed, because the body's incredibly clever at keeping blood sugar levels constant. And also, the biggies in the repurposed drugs, the Care Oncology Centre give a sugar-lowering blood, metformin, an antiparasitical drug, mebendazole, a statin, and also an antibiotic. Well, I think in a good going holistic regime, we're doing all of that because we're lowering the sugar by eating low GI foods. We can take, there's another herb I forgot to mention, artemisinin, which is an anti-malarial and it's anti-parasitic drug. So I often put that into the regime, and there is scientific evidence that brought recurrence down by 49% in people with bowel cancer. And that's the only group that's been studied. I'm sure it works in other cancers. So phenomenal impact of that one. In terms of a statin, we're getting people to come away from animal foods with high fat, so by reducing meat and cheese and cream and butter and so forth, and antibacterial, these lovely vitamins and vitamin C. So I think, having now been doing this for 40 years, that we're doing that anyway, with a really good holistic approach.
Yeah, thank you. Okay, so my final question today, which is not necessarily in connection with nutrition per se, but it is one of the things that I am always consciously aware of, and that is scans. Obviously, when one is diagnosed with breast cancer, you are then offered mammogram every year, and then if needs be, you can have an ultrasound scan as well at the same time. Can you share wisdom about scans, please?
Okay, well, the NHS thinking about scans is that they are really only licensed to do scans if it's going to change the management. So they do it to see, is a treatment working or is a treatment needed? And so the question about the frequency of scans, you know, with for example, with breast cancer, a well-trained doctor or nurse or consultant should be able to detect a breast cancer growing at the size that it's first detectable on a scan. So they always say that you need two out of three of the tests to confirm the presence of a tumor, which is the human examination and one or other of the scans. Now, unfortunately, ultrasound is not being used anymore for the diagnosing of breast tumors in conventional medicine. However, doctors such as myself can write a chit for people to go off and have an ultrasound done privately. So if you want to be checked, but you don't want to go through a big CT or MRI scan, you can see an integrative medicine doctor with a view to getting an ultrasound scan, which is a lot less radiation. I know you're interested in thermal mammography and whether that's good. I mean, that has been rated. One of the Bristol surgical team has put that on his list of tests as being as valid as ultrasound, palpation, and mammography. So what a thermal mammogram does is they cool the skin of the breast, and then they take a picture with a heat sensitive camera, which really shows if there's a very busy area, you know, where there's a lot of blood and circulation going on, there might well be a tumor in that place. So it is a valid other way of being tested. But I think that this is where, you know, just talking very briefly about the role of an integrative medicine doctor, which is what I am. I'm a fully trained GP, but I specialized in integrative medicine to help people get the best of both worlds, but also to know when they're safe not to do what's being advised, because some of my people feel that the medical treatments, the chemo, the radio, are going in the opposite direction to how they want to be dealing with this, because they're wanting to build immunity and you know, build their fighting force rather than potentially damaging it. But there are times when these treatments are life-saving. And so one of the things I do is help people understand the level of risk there is and the options, and perhaps when there might be, it might be safe to negotiate for a 3 or a 6 months window to work totally naturally, to see if you're winning, and also to advise about the advisability of a scan. And there are some situations like very early cancers or pre-cancers like cervix CIN3, which is about to go, you know, it's just before it's gone into being a cancer. It's really wise to have that treated, you know, and because you've got the get out of jail free card there. You know, if it's detected before it's turned into cancer, it can be treated, cured, removed definitively. So, you know, it can help to have some medical backup with these kinds of decisions.
Yes, thank you, Rosie. Thank you. So today we have talked about nutrition and supplementation, and whether you can or can't, should or shouldn't combine them. And the process of integration, I think, is the key word today. Is, you know, there are so many routes to go down, but to talk to somebody who has the experience of allopathic medicine and complementary medicine, you are getting the best information that you possibly can. And that is the route that I chose to go down, because I wanted to do what was best for me, for myself, for my health and well-being, that I could do safely. And your wisdom and guidance for me was absolutely invaluable. So the information will be obviously on the podcast, but we will also share information as well on the resources page. Rosie, you were also going to just mention about the nutrition from the health creation side.
Yes, so I have a daughter who's a fantastic, she's not entirely plant-based chef, but that's her major thing. And she and I have built a course together with Karen Mellors, who's also a nutritionist, and it's called the Health Creation Food Program. It's sitting on the website of the Health and Wellbeing Trust charity. And the URL for that is Health E-Learning, as of in letter E. So Health E-Learning .online, www.healthelearning.online. And there you will find it's the course by Eloise Daniel, which is the Health Creation Food Program. So what we've done is a 12-step program, because all of this is a bit overwhelming. So there's a 15-minute lesson on each of these 12 steps. And then Eloise has done some fantastic recipes to get you going in each one of these areas. So that's a fantastic way to just steady down and just get your head out of all the chaos and all the things you're going to hear, and just work your way through. And by the end of that, you can space it right out over 12 weeks. Or if you're a binge watcher, you can probably do it over a weekend. But, it's there, and we've poured our love and creativity into that for you.
Thank you. Thank you very much. And we will share that information on the resources page that can be accessed alongside the podcasts. So Rosie, thank you again for your wise words today. And we look forward to seeing everybody on our 3rd episode, which will be coming out very shortly. Looking forward very much to seeing you soon, Rosie. Thank you.
Fantastic, Jo. Thank you so
Bye.
much.
Bye-bye.
Bye.